If you're over 55, there's a good chance you're making this vision mistake every single day without even realizing it. But what if I told you that ignoring those cloudy spots in your eyes could steal your sight forever? And what if the solution is simpler than you think? Right now, as you watch this video, millions of people over 55 are slowly losing their vision to cataracts. Think of cataracts as clouds forming inside the clear lens of your eye, just like how a clean window becomes foggy and hard to see through. This lens, called the crystalline lens, sits right behind the colored part of your eye and helps focus light so you can see clearly. When proteins build up in this lens, it becomes cloudy, making everything look blurry, faded, or dim. The scary truth is that cataracts affect more than half of all people over 80, and they start developing much earlier than most people realize. What makes this even more concerning is that many people dismiss early cataract symptoms as just normal aging, not knowing they're missing out on treatments that could restore their vision completely. Why do some people keep crystal clear vision well into their 90s, while others struggle to see by age 60? What's the one mistake that millions of mature adults make that could be robbing them of precious years of clear sight? And how can a simple 30-minute procedure give you better vision than you've had in decades? Stay with me until the end to discover the answers to these life-changing questions. Your vision in your golden years may depend on what you learn in the next few minutes. Before we begin, please subscribe to our channel and hit that notification bell. Let us know in the comments which part of the world you're watching from. We'd love to get to know you better. Let me explain cataracts in the simplest way possible. Imagine your eye as a camera, and the lens inside your eye is like the camera's lens that focuses the picture. This natural lens in your eye is normally crystal clear, like a perfect piece of glass. But as we age, proteins in this lens start to clump together, creating cloudy spots. It's exactly like how a clean car windshield slowly gets dirty and makes it harder to see the road clearly. These protein clumps are what we call cataracts. They can start small, like tiny specks of dust on that windshield, but over time, they can cover the entire lens. The main cause is simply getting older. Our eyes have been working hard for decades, and this protein buildup is natural. However, things like smoking, drinking too much alcohol, spending years in bright sunlight without proper eye protection, having diabetes, or taking certain medications can speed up this process. The good news is that cataracts don't happen overnight. They develop slowly, which means you have time to recognize the signs and take action. And here's the most important part. Cataracts are completely treatable with a simple surgery that can restore your vision to levels you may not have experienced in years. Benefit number 1, dramatically improved vision that can make you feel decades younger. Most people don't realize how much their vision has declined until after cataract surgery opens their eyes to a whole new world. Imagine waking up and seeing colors more vivid than a spring garden, being able to read your favorite book without squinting, or finally seeing your grandchildren's faces clearly across the room. Studies show that about 90% of people who have cataract surgery experience significant vision improvement. One patient described it as taking off dirty glasses she didn't know she was wearing. The artificial lens that replaces your cloudy natural lens is actually clearer than your original lens ever was, even when you were young. This means many people end up with better vision after surgery than they've had in decades. You'll be able to drive safely at night again, see details in photographs, and enjoy activities you may have given up due to poor vision. The improvement often happens within days of surgery, though complete healing takes a few weeks. Benefit number 2, increased independence and confidence in your daily activities. Poor vision can make simple tasks feel overwhelming and dangerous. After cataract surgery, you'll likely find yourself more confident walking downstairs, cooking in your kitchen, and moving around your home. Many people report feeling more secure when walking outside, especially on uneven surfaces or in dim lighting. Reading becomes enjoyable again, instead of a struggle. You'll be able to see medicine labels clearly, which is crucial for taking medications safely. Driving becomes safer and less stressful, particularly at night when oncoming headlights won't create those bothersome halos around lights. Many people find they can reduce their dependence on others for transportation and daily tasks. This renewed independence often leads to improved mood and overall quality of life. Simple pleasures like watching television, working on puzzles, or enjoying nature become accessible again. Benefit number 3, reduced risk of dangerous falls and accidents. Cloudy vision from cataracts significantly increases your risk of falling, which can be life-threatening for people over 55. When you can't see steps, curbs, or obstacles clearly, even familiar environments become hazardous. Cataract surgery dramatically reduces this risk by restoring clear vision. Research shows that people with untreated cataracts are twice as likely to fall as those with clear vision. After surgery, you'll be able to see depth and distances accurately again, making it easier to navigate stairs, uneven sidewalks, and unfamiliar places. Better vision also helps you spot potential hazards like wet floors, loose rugs, or objects left in walkways. This improved safety extends beyond just walking. You'll also be able to handle tools, kitchen equipment, and household items more safely when you can see them clearly. Benefit number 4, enhanced ability to enjoy hobbies and social activities. Many people gradually give up activities they love as their vision declines, often without realizing how much cataracts are affecting their enjoyment of life. After surgery, you'll likely rediscover the joy in activities you may have abandoned. Reading becomes effortless again, whether it's books, newspapers, or even small print on packages. Crafts like knitting, sewing, or woodworking become possible again when you can see fine details clearly. Playing card games or board games with family and friends becomes enjoyable instead of frustrating. Many people find they can return to driving, which opens up opportunities for social activities and outings they may have missed. Watching movies or television becomes more enjoyable when you can see facial expressions and details you've been missing. Gardening becomes safer and more pleasant when you can distinguish between plants and weeds clearly. Benefit number 5, better sleep and overall health from improved light sensitivity. Many people with cataracts develop increased sensitivity to bright lights and glare, which can disrupt sleep patterns and daily comfort. The artificial lenses used in cataract surgery often provide better light management than your original lenses. You'll likely find that bright lights are less bothersome, and you won't need to squint or shield your eyes as often. This can lead to better sleep because your eyes won't be as strained during the day. Many people also report that colors appear more vibrant and true to life after surgery. The improved vision often leads to better overall mood and mental health, as you'll feel more connected to your environment and the people around you. When you can see clearly, you're more likely to stay active and engaged, which benefits your physical and emotional well-being. Benefit number 6, long-lasting results that can last the rest of your life. Unlike glasses or contact lenses that need frequent updates and replacements, cataract surgery provides a permanent solution to your vision problems. The artificial lens implanted during surgery, called an intraocular lens, is designed to last a lifetime. You'll never need to worry about cataracts developing in that eye again because the cloudy natural lens has been completely removed. While you may still need reading glasses for very fine print, many people find their overall vision is dramatically improved for decades after surgery. Some types of artificial lenses can even reduce or eliminate the need for glasses altogether. The surgery itself typically takes only 30 to 40 minutes, and most people return to normal activities within a week. This means a relatively small time investment can provide benefits that last for the rest of your life. Benefit number 7, potential cost savings over time compared to ongoing vision problems. While cataract surgery does require an upfront investment, it often saves money in the long run compared to the costs of living with poor vision. Many people with cataracts spend increasing amounts on stronger prescription glasses, special lighting, magnifying devices, and other vision aids that provide only temporary help. After cataract surgery, you may need fewer prescription updates and special devices. The reduced risk of falls and accidents can also prevent costly medical bills and hospital stays. Many people find they can reduce their dependence on others for transportation, reducing costs for ride services or family assistance. Most health insurance plans cover cataract surgery when it's medically necessary, making it an affordable option for most people. The improved vision can also help you continue working longer if you choose to, providing continued income and benefits. Risk number 1, possible complications during or after surgery, though serious problems are very rare. Like any surgery, cataract surgery does carry some risks, but it's important to know that serious complications occur in less than 1% of cases. The most common issues are minor and temporary. Some people experience mild discomfort, swelling, or temporary blurriness that resolves as the eye heals. Very rarely, infection can occur, but this is prevented through careful surgical techniques and antibiotic eye drops. Some people may experience persistent dry eyes after surgery, but this is usually manageable with eye drops. In extremely rare cases, the artificial lens may shift position or the retina may detach, but these complications can usually be corrected with additional procedures. The vast majority of people who have cataract surgery experience no serious complications and are very satisfied with their results. Your surgeon will discuss all potential risks with you before the procedure and help you understand how to minimize any chances of complications. Risk number 2, the need for additional procedures in some cases. While most people achieve excellent vision with their initial cataract surgery, some may need additional treatment later. About 20 to 30% of people develop a condition called posterior capsule opacification, months or years after surgery. This happens when the back part of the lens capsule becomes cloudy, causing vision to blur again. The good news is that this is easily treated with a simple laser procedure that takes only about 5 minutes and doesn't require cutting into the eye. Some people may also need a minor adjustment to their artificial lens position, though this is uncommon. If you choose a basic artificial lens, you'll likely still need reading glasses for close-up work. Premium lenses that reduce the need for glasses cost more and may not be covered by insurance. It's important to have realistic expectations and understand that while cataract surgery is highly successful, perfect vision isn't guaranteed for everyone. Now let me walk you through exactly what to expect if you decide to have cataract surgery. The first step is a comprehensive eye examination with an ophthalmologist who specializes in cataract surgery. During this visit, they'll measure your eye carefully to determine the correct power for your new artificial lens. You'll discuss the different types of lenses available and choose the one that best fits your lifestyle and budget. Before surgery, you'll need to use antibiotic eye drops for a few days to reduce infection risk. On the day of surgery, arrange for someone to drive you home because your vision will be temporarily blurry. The surgery itself is usually done with eye drops to numb the area, so you'll be awake but comfortable. Your surgeon will make a tiny incision in your eye and use ultrasound waves to break up the cloudy lens, then gently suction out the pieces. The new artificial lens is then folded and inserted through the same small incision, where it unfolds into the correct position. The incision is so small it usually doesn't require stitches and heals naturally. The entire procedure typically takes 30 to 40 minutes, and you'll rest in a recovery area for about an hour before going home. After surgery, protecting your eye during healing is crucial for the best results. You'll wear a protective shield over your eye while sleeping for about a week to prevent accidental rubbing or pressure. Use the prescribed eye drops exactly as directed, usually antibiotic drops to prevent infection and anti-inflammatory drops to reduce swelling. Avoid getting water directly in your eye for at least a week, which means being careful when showering and avoiding swimming pools. Don't lift heavy objects or do strenuous exercise for a few weeks to prevent pressure buildup in your eye. Most people can return to normal activities like reading and watching television within a few days, but avoid driving until your doctor confirms your vision is adequate. Wear sunglasses outdoors because your eye may be more sensitive to light during healing. You'll have follow-up appointments to check your healing progress, typically 1 day, 1 week, and 1 month after surgery. Most people notice vision improvement within a few days, with continued improvement over several weeks as healing completes. It's important to understand that cataract surgery isn't right for everyone, and there are some situations where extra caution is needed. If you have active infections in or around your eye, surgery should be delayed until the infection is completely cleared. People with certain autoimmune diseases or uncontrolled diabetes may have slower healing and higher complication risks. If you're taking blood-thinning medications, your doctor may need to adjust these before surgery to reduce bleeding risk. Some people with severe glaucoma or other serious eye conditions may need special considerations during surgery. Very rarely, people with certain allergies may react to the medications used during surgery, so inform your surgeon about all allergies and medications you take. If you have dementia or severe anxiety that makes it difficult to stay still during surgery, special arrangements may be needed. Age alone is not a barrier to surgery. Many people in their 80s and 90s have successful cataract surgery, but overall, health should be stable enough for the procedure. Thank you for taking the time to learn about this sight-saving procedure. If this information has been helpful, please give us a thumbs up and share your thoughts in the comments below. Have you or someone you know had cataract surgery? We'd love to hear about your experience. Please share this video with friends and family members who might benefit from learning about their options for clearer vision. You'll notice we have 2 videos on the screen now. I'm sure you'll enjoy continuing to watch more content like this that can help you live your healthiest, most vibrant life.